We're back in the recommendation to keep hemoglobin A1C below 5%. We're talking about mechanism. We've explored factors that contribute to elevated A1C. Now we're looking at the mechanism underlying these factors. We talked about activation of the sympathetic nervous system. Now we're going to discuss how inflammation leads to insulin resistance and elevated hemoglobin A1C. Inflammation, which results in production of inflammatory molecules throughout the body, can be caused by these factors that we previously mentioned as causing elevated hemoglobin A1C. Tobacco use, depression, insufficient sleep, lack of physical activity, and being overweight and obese are all known to cause inflammation throughout the body. The effect of chronic inflammation in the body affects hemoglobin A1C in several ways. Inflammation directly works on the pancreas. The pancreas is the organ that produces insulin. The beta cells of the pancreas in particular produce insulin. Insulin is required to lower blood sugar levels. If there is chronic inflammation throughout the body, insulin production is impaired and beta cells start to die, which means that the body's ability to clear glucose from the bloodstream is no longer effective due to a lack of insulin production. To make matters worse, inflammation works on the liver to break down stored glucose in the form of glycogen into glucose and release that glucose into the bloodstream. So we're raising blood sugar levels and we're impairing the body's ability to produce insulin to make those blood sugar molecules enter the cells. I want to give a special mention to adipose tissue. When a person is overweight or obese, the fat cells become inflamed, and the fat cells, especially the ones in the abdomen, produce inflammation independently of the systems that are in the body in normal weight people. These inflammatory molecules act on the liver and the pancreas in the ways we described. The downstream effect, therefore, of inflammation, where we have a lot of glucose pumping into the bloodstream and not a lot of insulin around to deal with it, is elevated glucose in the blood but not in the cells, because insulin is not available to signal to cells to take it up.